And my name is Liana Leonov. I'm the president of the Global Positive Health Institute, and this is a very exciting moment for me and all of us who have been behind the scenes working very hard over the past year, more than a year now, to establish this Global Positive Health Institute. And we're very excited to share this moment with you, to share our vision and where we're headed and how all of you can be involved in this important movement. For those of you that don't know me, I'll spend a few seconds here to introduce myself. I am a past president of the American College of Lifestyle Medicine. I'm the current chair of the Happiness, Science, and Positive Health Committee of the American College of Lifestyle Medicine. I am the vice chair of the American Board of Lifestyle Medicine. I'm an immediate past president of the International Positive Psychology Association. And as you can see, there's a theme there in my background, my passion for lifestyle medicine and my passion for positive psychology. And this passion has developed over a number of years. For years, decades really, I have been struggling with the idea that in order to have health, any kind of health, of course, we all need healthy lifestyles, complete healthy lifestyles that includes and addresses who we are as individuals, what makes us happy, what gives us meaning, what helps us connect, and we want to make connections, we want to play, we want to do meaningful work. And all of that is part of a definition of health and so much more. And I struggled with how can a healthcare system, how can health practitioners, medical practitioners help their patients, how can we help ourselves to achieve what that level of health and well-being, what I call total well-being. And in now about 4 years ago, in 2017, I attended the conference, the World Congress of the International Positive Psychology Association. And on stage was the then outgoing president of that international organization, Dr. Barbara Fredrickson, who's a leading scientist and expert in the area of positive psychology. And her keynote address was really ultimately all about this connection of positive emotions and healthy behaviors and health. And it was a light bulb moment for me as I saw this connection and this opportunity for those of us in healthcare to seize the moment, to seize that science, and to do more with it. At the time, I was in a crowded ballroom, conference room with probably more than 2,000 colleagues, but many of them were not in the healthcare industry. They were in human resources, they were in education, they were in many other fields that are taking advantage of the science of positive psychology. And I realized, wow, you know, this is an opportunity to bring in my colleagues from healthcare, my colleagues from medical practices around the world, and do the same and start making use of this science. And then what happened was, with our work with the American College of Lifestyle Medicine, we did an inaugural summit on happiness, science, and healthcare in 2018 with collaboration through Dell Medical School and their generosity. We had a wonderful summit think tank that led to a couple of publication of a couple of articles, as well as a mini textbook. And then over time, I realized that we needed to put even more attention and resources into this area of intersection between health and positive psychology. So the Global Positive Health Institute, we're all about optimizing healthcare with positive psychology. And thank you all for being here. You're the early adopters of what we're looking to do with this new institute. Thank you for joining our adventure. And I hope that will inspire and invigorate you to do more with this movement with us and join us. What we're going to do in the next half hour or so, and then we'll open it up to some interaction, is to let you know what the Global Positive Health Institute is, introduce some of our board of directors, talk a little bit about why it's so important to do this now. Why now? Why so? Is it so essential that we gather around this topic and do more with this science? And then we're going to close out with how it impacts health and healthcare and the role of healthcare stakeholders. And finally, a call to action. And we'll make some suggestions of ways and things that you can do to help us along the way. So we're the Global Positive Health Institute. So each piece of the name says something about us. So we're global and growing. We have an advisory council that's expanding, many people from the lifestyle medicine movement within the United States, but also globally, internationally, and you can see some of those countries there. We're now over 20 countries strong. The middle of our name, positive health, is a specific coined term. The term positive health was coined by Dr. Martin Seligman, who is considered the father of positive psychology, and he defined this term somewhat in the way that I am defining it here for you, but I've paraphrased it and made it in my own, which is that positive health is a health attribute that produces longer, healthier, and healthier life and lowers disease risk over and above what we can achieve and accomplish through traditional health care. And the last part of our name is institute. We're an institute, which means that we are absolutely focused on the science and using that science, summarizing that science, and then developing educational programs, training programs, and to continue to build on that science. So we would like to make connections between researchers in psychology as well as health and medical practitioners to take all the wonderful work that has mainly been going on in counseling settings and psychology settings and now transfer them, translate them, and build the evidence base in our primary health care settings, our lifestyle medicine settings, and other medical specialty settings. So I've been throwing around the word positive psychology, and before we go too farther along this road, I want to show you this definition that came from Martin Seligman and also other colleagues, including Mihaly Csikszentmihalyi, and it is a fairly broad definition. It's the scientific study of positive human functioning and flourishing on multiple levels that include the biological, personal, relational, institutional, cultural, and global dimensions of life. So it's embracing all positive dimensions of life, all dimensions of life, and making the most of them. And when someone who's a newcomer to the term positive psychology, they hear that, that might say, you're just trying to be positive all the time. That's kind of very Pollyanna. It's not possible as human beings to be positive all the time. And indeed, that is true. And indeed, positive psychology embraces all emotions. We are human beings. We have ups and downs. We embrace the term emo-diversity. We have all those emotions. But instead of focusing on simply getting rid of the negative emotions and treating the negative emotions and mental states, we certainly want to address those. But we also want to fully focus on and elevate and emphasize what's going right, our strengths and our positive emotions. And we'll go much farther in our health and well-being if we do so. So the values that we are implementing as we move forward with the Global Positive Health Institute is that positive psychology, along with all elements of a healthy lifestyle, can be incorporated in self-care and healthcare and healthy communities so that we produce mental health, emotional health, social health, physical health, and this state that I've just defined of positive health. Here is a logic model, which I won't take time to go into a lot of detail. It is also on our website, and I encourage you to take a look at it. It's a place for us to start a dialogue. It's a logic model that shows how positive emotions can be related to all of those elements of health that I just mentioned. And there are scientific fields of study, areas of study, that are looking at these various pieces of the logic model. Over time, we would like to see more research as we expand on the science that is hopefully demonstrating that indeed this logic model is correct. And of course, where it's not correct, we want to fix that as well. We have a long ways to go in terms of that research, but that this is a free framework for us as we move forward with research, as well as the Global Positive Health Institute's desire and goal to summarize that research for you and to make tools for you that you can use for yourselves and in practice. We'll use a framework like this to make sure that we are complete and transparent and looking at the entire the comprehensive health system, both in terms of the body as well as in healthcare infrastructure. And all of these pieces of the framework and logic model can help us contribute and give us a way to think about and organize our thoughts and our science summaries. Ultimately, what is our vision for the Global Positive Health Institute? It is, in essence, to transform healthcare by making positive psychology an integral and standard part of healthcare delivery. I've for years been giving talks on this positive psychology and its impact on health, and looking to inspire colleagues to consider a future of a lifestyle medicine and other areas of medicine that will incorporate fully healthy lifestyles, but also with an emphasis on positive psychology. And what I suggested is an example of a prescription, the prescription of the future, which not only includes traditional health behaviors such as exercise and nutrition that you have here, but that in a standard way we are prescribing and thinking about in a routine manner the positive psychology habits and activities of our patients, and of course for ourselves as well. So I've shared the vision. The mission then is how we're going to do this. We're going to make the science of positive psychology applicable to a full spectrum of medical health practitioners and healthcare settings by expanding a network of champions, partners, collaborators, and that includes you. You are the beginning of this, and this launch is the beginning of this with your participation. We're going to showcase leaders and role models who are doing this. We're going to make those science summaries as accessible as possible, try to stay up on the latest science, and make it easy to access in our learning library. We're going to take some of those key messages and disseminate them as widely as possible through social media and other communication. We're going to develop training programs, and we're going to look for ways to make all this very practical and develop tools for all of us to use. So the unique value of the Global Positive Health Institute is to be able to have the luxury to focus as a single organization, to have this laser focus on this intersection of positive psychology and health for health and medical practitioners. There aren't other organizations that are laser focused in making this science available for healthcare settings and medical practitioners. And over time, we do have like-minded organizations that we will work with, like the globally all of the lifestyle medicine societies, including the American College of Lifestyle Medicine, also all the positive psychology societies and the International Positive Psychology Association. They all have things to contribute, and together we will be stronger. But it is the GPHI that has that laser focus on this intersection. Based on recommendations from our advisory council, our early priorities will be, from a strategy perspective, is to grow our network of champions. So again, thank you for being here. You are step one on our road to success. And in terms of priority topics, the Advisory Council has recommended that we do more around this topic of this reciprocal relationship between a healthy lifestyle and positive psychology and health behaviors. And also, due to the current times, and you'll be hearing a little more about that, how we can use positive psychology to address stress and improve mental health. So ultimately, what are the components? What does the GPHI offer? We have a board of directors that we'll be introducing very shortly. We have this growing, expanding advisory council. Next year, I hope to have a special council of positive psychology experts to help advise us. We'll have a circle of collaborators and in the future partners of like-minded organization. We'll be over the next year building this library of scientific reviews, videos and courses. Starting next year, we'll start to offer, quote, prescription videos for patients to learn and apply it, particularly for certain medical conditions. We're going to continue to expand our champion network and develop educational programs. So with that, I'm going to stop the screen share and invite to the stage and introduce some of our council, some of our board of directors. And before I do that, here on the slide you have a complete list. There are 6 of us strong. I'm the president. We have Joe Raphael, whom you'll hear from shortly, who's our treasurer. He is a marriage and family therapist and has many other education and claim to fame, as you can see from the many letters behind his name. We've got for our secretary, Kristen Collins, who I am very grateful for and who is unable to join us today, who has been the cheerleader from moment one when we talked about, well, why don't we start a new organization? Why don't we make this a reality? So thank you, Kristen. You'll hear from Simon Matthews, one of our directors, who's also a CEO of Well Coaches Australia and Singapore. We've got Scott Cashman, who's also unable to be with us, who brings to the table his expertise as a healthcare executive and has recently accepted a new position that we'll be hearing about, but has had a lot of experience in how we can leverage this and leverage what we're trying to do for the healthcare infrastructure. And last but not least, you'll get to meet Cassie Kale, who is an attorney. She has her own firm. She also has executive experience in human resources and has been a tremendous assistance. As you may understand, there are a lot of legal implications in starting an organization like this, and so I'm very grateful for her as well. So I'm going to stop the share. And I am going to all right, Joe, this is Joe Raphael. Welcome.
Well, thank you. Can everybody hear me okay? Hopefully you can hear me. My name is Joe Raphael. It's an honor to be here. It's an honor to work with this team. I come from a background, I like to explain it as a clinician turned executive. And I've really been dedicating my career to purposeful collaborations that are all about how we transform healthcare, focusing predominantly on what I like to call decision-focused well-being. And so one of my interests with the Global Positive Health Institute has been supporting the standardization of the clinical and the operation values and principles that you're going to hear throughout today and that Liana has already hinted at. So I look forward to getting to know each of you and moving this movement forward. Thank you so much. Take care.
Thank you, Joe. And I am going to call on Simon Matthews next. Welcome, Simon, if you'd like to say a couple of words.
Absolutely. Oh, there we go. I think there we go. Yes, my audio is working. I just wanted to check that. Good morning, everybody. It's lovely to be here. Thank you so much. It's a great privilege. I'm speaking to you from my home on the east coast of Australia, about 1 hour north of Sydney. It's nearly 1 a.m. on Saturday morning, so I'll be heading to bed shortly after this to get up early in the morning and anchor the second block of tomorrow. I'm a psychologist professionally and a coach. You heard Liana mention that I oversee the operations of Well Coaches School of Coaching out in this part of the world, carrying on the great work begun by Margaret Moore all those years ago in the US. It was an absolute thrill to be asked by Liana to join the board of directors of the GPHI, and for me represents an opportunity to do one of the things that I'm very passionate about in healthcare, and that is to be able to make a small difference to a large number of people, and that's part of a vision that I captured for my own professional life some years ago. I spent a lot of years doing therapy with people, similar to Joe, marriage and family therapy. A lot of years working in some other areas of psychology, but the last several years have been given over to lifestyle medicine, the practices of lifestyle medicine. And for me, the principles, the vision that sits behind the GPHI just captures everything that matters to me about what it means to live a healthy, vibrant, and most importantly, productive life, a life in which we can use our own health and well-being as a resource for the betterment of the communities in which we live. So welcome to you all, and I hope you capture that vision as well, and walk with us as we begin and continue this journey.
Thank you, Simon. And lastly, we're going to meet Kathy. Kathy Cayley, hi.
Good morning, everyone. Thank you, Liana. Pleasure to be here. I'm honored as well to be a part of this great new organization. As Liana said, I'm a lawyer, so I try to bring those skills to the organization, but I also have a master's in counseling psychology. So my passion for psychology definitely runs deep. For most of my 20-year career as a lawyer, I've worked in health systems. That's actually where I met Kristen Collins, who introduced me to Liana. And I've always just used that as an outlet to help others. So, you know, we talk about sense of meaning and that being important in positive psychology. So I've always enjoyed working with organizations that really benefit the greater whole, whether that's health systems. Now that I'm out on my own practicing, I can bring the knowledge from health systems to Global Positive Health Institute, and also my passion for championing mental health causes, as well as recovery and addiction issues, which can be greatly supported by introducing positive psychology practices. So I also have a certification as a yoga instructor. So I kind of am like a little bit of a wellness hippie lawyer. So I kind of fit in here on a number of different levels, and I'm happy to be here and support us as we move forward. So thank you.
Thank you, Kathy. All right, I'm going to go back to our slides. And this next segment of our program is we're going to hear from a couple of wonderful colleagues that I'll introduce them right now, and then they'll go one after the other. First, you'll be hearing from Dr. Gia Merlot, who's becoming a good friend now, and I've gotten to know her through the American College of Lifestyle Medicine and our like-minded interests in lifestyle medicine and happiness science. She's a clinical professor of nursing and senior advisor on wellness at New York University, as well as clinical professor of psychiatry in the New York University Grossman School of Medicine. And she's recently authored and produced an academic book called Principles of Medical Professionalism. And Gia will be followed by Kate Collins, also now a good friend and who I've gotten to know over the years through lifestyle medicine and other like-minded interests. She's the director of lifestyle medicine for Silicon Valley Medical Development in the San Francisco Bay Area of California, and also is the current president of the American College of Lifestyle Medicine. So with that, I will let Gia take it away here. All right, Gia. Oh, let me get
Thank
back
you.
to the
Can you hear
slides
me?
here. Yes, we can hear you.
Okay, great. Great. So we can still see you, Liana, but as long as that's okay with everyone.
I can unspot myself here. Let's see, remove spotlight. There we go.
Okay, beautiful. Thank you. So I'm Gia Merlot, as Liana had said, and I'm really excited to shift gears a little bit and talk about where we are and why this is so important at this time. So we are unfortunately in a very unique place in modern history where almost every country globally is experiencing a crisis within the citizens, unique for many reasons. This crisis, unlike many crises that we've had in the past, is affecting the poor and the rich. It's independent of financial status or religious affiliation. It's independent of your age, and it's affecting, unfortunately, the young and the old. And as we all know, this is creating a lot of stress, and it's stress that we all experience and feel. And our vision in GPHI is to provide opportunities and solutions that would help in this time of prolonged stress. We know that providers of service have been physically working nonstop. Many of us in this room know that extremely well. Who has been taking care of our needs? Who's been taking care of their mental health? When is the pandemic going to be over? And when are we as providers giving some time more than we have, but when are we stopping to renourish and replenish ourselves? So given that in mind, I would ask all of us in the audience today at the beginning of this beautiful conference to take 2 deep breaths, put your feet on the ground, close your eyes for a moment, and just be present compassionately for yourself. Okay, thank you. You all do so much. Next slide, please. Liana, next slide. So as providers, these stats on the slide are not new to us. We know that our patients are suffering and struggling, but I also know that we are struggling and suffering as providers. Sometimes we don't want one more thing on our to-do list. Please note, bringing positive psychology and wellness is not about that. We are not saying spending time to meditate, write journals, or do yoga is to create more chores for you to do. Indeed, many of us don't even have enough time to sleep. I hear you. What this institute is trying to do is not to add burden, but maybe release some of that stress so that you can do what you enjoy and be there for others as yourself. Using the tools and the resources that are available, we suggest that you take a very individualized approach to what works for you, then take that and through this pandemic, help others that are in your circle, help them as well. The mental health crisis is global. 51% of respondents from 7 countries reported that the pandemic has impacted their mental health. The International Committee of the Red Cross is reporting that, is the first statistic I put up there. The second statistic is on a study that was done that said that the higher rates of depression, anxiety, 1 in 4 youths are feeling depression, 1 in 5 youths are feeling increased anxiety. We all know this, we feel this, but just to drive it back home, as we're focusing on the positive, let's also remember why this is so relevant and important. Next slide, please. The need for us to focus on ourselves is even more significant as we're moving forward in the second and third year of the pandemic. The majority of adults are stressed. We are not sleeping well. We're not eating healthy foods. And we're isolated and we don't know where to turn. Please note how I'm stating this. This is an inclusive way of stating these problems. It's not that they, our patients, our clients are not doing this. We, as a general populace, are not doing this. Next slide, please. This is a screenshot of the cover of my book, and you may wonder, what does this have to do with what we're talking about? So my take on medical professionalism, and part of what I put in this academic book, is that we really need to be at the intersection of what our mandate is in professionalism and happiness and wellness for ourselves in concert for taking care of others. This quote that I put in there, many of us in the profession have a well-intentioned belief that sacrificing our well-being for more time with our patients is good or even necessary. But in fact, this goes against our commitment to professionalism. We must put the oxygen mask on ourselves in concert or close to the time that we're putting it on our patients. While we cannot change the course of the pandemic, with this conference, we can hope to strive to give you more support and bring a more positive activities into your own lives and your patients. In the next 2 days, we're going to discuss this bidirectionality with the positive emotions and healthy behaviors. Thank you. You can do the next slide.
Okay. All right. Thank you so much, Gia. I think that what you've had to share is absolutely essential, that we have this collective understanding as to what's so special about what we are looking to do together through the Global Positive Health Institute and with everyone's participation. Again, as you will put it well, it's for ourselves as well as for our patients. And now I'm going to introduce it back over to Kate to continue this discussion about why now and the role of healthcare. Take it away, Kate.
Can you hear me now?
Yes.
Excellent. Okay. So good morning, everyone. And thank you, Leanna, for offering my participation in the launch of the GPHI, which is definitely going to be a bright spot in all of our futures. And as Gia, stated, the pandemic has, brought a lot of stress to all of us, providers and the general population. But we know that even before the pandemic, stress levels had been building in patients and providers. And as a cardiologist, I've seen the direct effect of stress on patients' physical health, its contribution to cardiac ischemia and chest pain, arrhythmias such as atrial fibrillation and ventricular tachycardia, hypertension, and even the sometimes life-threatening condition called broken heart syndrome, which is directly related to stress. And all of us who work in the clinical arena recognize that stress also impacts adherence to treatment, compliance to our recommendations, but also healthy behavior changes. But on the other hand, we know that positive emotions can really drive improvement in health behaviors that in turn treat and oftentimes reverse 80% of chronic diseases, the diseases that are largely lifestyle borne. Next slide. So we simply cannot solve these chronic conditions if we don't embrace positive psychology and how it is embedded into coaching theory. We know, and I've seen this, year after year in imparting education and knowledge to my patients, that was only a small sliver of really activating behavior change and activating a change. And I think that knowledge and education is a small sliver for providers. But the much larger piece of it is finding that secret sauce for behavior change, and the underpinnings of that are so often in the field of positive psychology. Next slide. So as we approach a new vision of health, we need to routinely address all elements of health, which are intricately interwoven, both our mental health, emotional, social, and physical health, as well as positive health. And we know that positive health is promoted by interventions or activities as well as emotions and the mindsets that we bring in our clinical encounters, the mindsets with which we approach one another in our social connections. And that is also all based in the science of positive psychology. And in doing so, we use positive health as a core mechanism to thrive and grow even in adverse conditions of any sort, particularly accelerated in the past 2 years. Next slide. When we address transforming healthcare and our well-being crisis, we need to do this at 3 levels. And the way I look at it, we need to do it in the umbrella level, or that's the population level, that we begin to look at these models and integrate positive health and solutions in positive health into those models so that we can really get to a situation where we have global, equitable, and whole person restoration at that large level, at that population level. But also at the individual patient level, we really have to approach this through the lens of positive health and lifestyle behaviors, and work in those 2 contexts to really handle the vast majority of death and disability, to chronic disease, to lifestyle-borne diseases, where we really have to focus on behavior change. But then in the office level, it's really, I would say, positive provider and patient interactions, but also provider to provider interactions that are positive, as well as in a group setting, patient to patient interactions that can be so healing for both providers and patients, achieve excellent outcomes, but also make everyone's life more rewarding. And next slide. So if we look at how we've historically approached healthcare, we go into looking for a patient's chief complaint. Now, certainly we need to look at symptoms. Patients don't always come for well visits. They come because they're having or experiencing something that's concerning to them, a symptom that's concerning to them. But we do frame it around a chief complaint. We focus on diagnosing and treating that complaint, and we maintain, if you will, a complaint list for each patient, or a problem list for each patient. And then we're constrained by a current healthcare and reimbursement system that offers, a little bit in the way of prevention, which is a lot of times related to checking a box and screening for prevention on some category, but is quite limited in actually providing lifestyle interventions or implementation of those preventive strategies. So if we look a little beyond and we think about adding to that a perspective of positive healthcare, where we also integrate into the patient record and into the interaction, what are the patient's strengths and what are their goals and their vision? We need to focus also on using those strengths to adhere to healthy behaviors, to elevate those and put those into the visit so that we can recognize that we can use these patients' strengths and self-efficacy that patients have maybe in other regions of their life to achieve their treatment goals as it relates to health. And then along with maintaining a list of problems, we need to maintain a list of the patient's strengths and the resources that they have available to them. And overall, by doing so, we can really get to using a whole person care approach. And of course, we need to adapt our reimbursement system that values putting this also into the context of patients' medical care. So thank you again, Liana, for allowing me to participate in this fabulous conference that is just going to be so positive for all of our futures.
Thank you, Kate, and thank you again, Gia and Kate. And I should mention that I'm looking forward to ongoing work with both of you because they're also serving on our GPHI Advisory Council. And thank you for your presentations. What I'm going to do now is, for the sake of time, we're skipping over a couple of slides, and I want to wrap up our launch with a few thoughts and a call to action for all of you. So if the call to action is for all of you to follow along with us and to be actively engaged in helping us figure out how to best make use of the wonderful science of positive psychology in healthcare so that we can together achieve this vision where we have proactive patients and the public who are seeking to achieve total well-being through the whole person self-care approach and have that also in healthcare, not just self-care, and that we have healthcare professionals that are getting training in positive psychology and behavioral medicine along with lifestyle medicine. They're implementing these strategies of healthy lifestyles and positive activities routinely, prescribing them in clinical practice routinely, as Kate said, in our interactions through with coworkers and patients, etc., that we're monitoring for these constructs of total well-being. So it's not just about physical or mental health, it's emotional health, social health, and this construct of positive health, which brings us in a much better place overall with our well-being. And we need to figure out then how can we make this practical for ourselves in terms of tools and interventions, and refer to resources outside of healthcare, technology, etc., other community-based approaches and organizations that can help us with this. And ultimately, what we're doing here is looking for more effective ways to address the current pain point that we are faced globally. We are now entwined in a world mental health and chronic disease epidemic, if you will, and on top of that, we have the burden of the actual COVID pandemic, which is now leading to a long-term, what we would call syndemic. These are all coming together, rearing their ugly face, and we must face them together, solve them together, and look to every possible tool to do that. I hope that those of you that are participating in the conference or are able to take advantage of our other offerings over time on the GPHI website will gain insights and ideas about how we can collaborate to advance this movement globally. We'll be working with, of course, our partners like the American College of Lifestyle Medicine, the Global Lifestyle Medicine Alliance, and other groups. If you're involved and healthcare organizations and community organizations that might be interested, please contact us. We definitely are stronger as we grow and come together. And I hope that you can embrace these, what we would call micro nuggets of learning and be able to implement that in your day-to-day. Like Gia earlier had us be grounded, that before you have any interaction with patients, if as a medical provider, clinical provider, or if in any other interactions throughout your day, that you pause a moment, be fully grounded, mindfully grounded, tap into your kindness, your ability as human to human to offer something to someone else. Certainly as practitioners, we're healers, and there are rewards there that can rebound for us personally and professionally, so that ultimately we're fostering joy despite the tough times that we all face now and will likely continue for the future, particularly as we don't really have a good sense of what's going to happen with the pandemic long term. And as we collectively harness these micro nuggets of positive interactions and activities, they'll become macro nuggets, if you will, that will bring solutions to our day together. So with that, I will close with a few very specific action steps. I encourage you to participate in the conference. It's not too late to register. I should say that all of us who are involved behind the scenes in this organization are volunteers. Thank you for those of you who have registered for the conference, and your registration fees are helping to help us get this organization launched. We are hopefully it will get to continue to increase programs and offerings to support the organization. Invite colleagues to join. If you already are participating in the conference this first day and you are excited about what you see, you can text and invite other colleagues to participate. Registration is open until 8 o'clock this evening Pacific time, and everybody who wants to have a continuing education credits, other than the pharmacists, we weren't able to get pharmacists, but every other CE category, you can earn your credits through September 28th for 10 days after this conference. Regardless of whether you're part of the conference or some of these other offerings, follow us at Global Positive Health on Facebook and Instagram. And look to see how you can use this for yourself, even whether we also have some participants that are not health professionals, and look for ways to learn and apply it for yourself. We're looking for volunteers to help at many levels, and particularly to help us with building our science library, creating videos and other tools. Again, as I mentioned earlier, if you have contacts in health systems or organizations that might be interested in collaborating with us, please contact us. And if you have ideas for other grant sources or other ways that we can really lift up this organization financially, that's greatly appreciated. It is a charitable organization. Right now, currently only in California. We'll be expanding that opportunities. So that's why right now our greatest source of funds is through registrations of these kinds of conference offerings. I recently published a popular book, Strengths in the Mirror, that talks a little bit about these concepts of lifestyle medicine and positive psychology. All of those revenues are going straight to this organization as well. So I recommend that as well. So those are just a few ways that you could be involved, very concrete ways, and appreciate your involvement and interest today and participation.